Well, dry eyes can be an uncomfortable and frustrating problem, but your optometrist can help. Dr. Andrea Lasby in with some tips. Thanks so much for being here,
Thanks for having me.
I just want to ask you, so like, is it these, what are some of the kind of signs and symptoms? Like, how do I know if it's just like I've had a long day or if it's something I need to get looked
So
at?
every patient experience is unique, but I would say the most common symptoms people find are burning, stinging, grittiness. Sometimes they'll feel like there's something stuck in their eyes, like a foreign object, or they'll get fluctuating vision is a big one. In some cases, and really commonly in Calgary as well, people actually complain of excessive watering. And so that sounds counterintuitive, I know, but it's actually excessive watering can be a sign that dryness is occurring.
All the moisture's leaking out.
Yeah, that's right.
And so how do I know if it's just like, I mean, if I'm just having an hour of this, or if it's like, at what point is it kind of, what's the threshold, I guess?
Really, it depends. I mean, we know that 3 out of 5 Albertans just use over-the-counter medications. They go, stand in front of a pharmacy and say, okay, here are all the medications. I'll just pick one and hope it works. Yeah. But really, in reality, that could be doing further damage to your eyes because some of the preservatives could already irritate your sensitive corneal tissue already. So we want to make sure that if you are experiencing symptoms, you go to your local optometrist for proper diagnosis.
So I know you're going to recommend that we get things checked out properly, but in the case of an over-the-counter drop, so if you use it and it's not working pretty quick, like you should pretty quickly escalate if that's a...
Absolutely. So go visit your local optometrist. All of your medical concerns, including dry eye, or if you have an eye infection or sudden vision loss, they are covered under Alberta healthcare, and a lot of Albertans don't know that.
So why is it important then to get this checked out? And what do you do? Because you've got some kind of devices here as well. I want to get to those.
So dry eye can be a sign of something more severe, something going on. Sometimes dry eye can be a symptom of a systemic disease, like an autoimmune issue that your optometrist can review by just looking at your general health. But sometimes it can actually show us that you have an eyelid disease called blepharitis. So if we take a look at some of these models, you can see how when there's inflammation there, we have little glands.
Want to hold that up for a moment?
Yeah, sure.
Can you just kind of show us?
Let me grab that. So this little model shows that if this is kind of a normal eyelid, and if you have a lot of debris, or if you have these little meibomian glands, I know it doesn't look great, right?
That looks really awful.
Yeah, so these little glands, they get backed up, and so when they get backed up, oils can't get onto the surface of the eye. And without that, if you think of your eye like a puddle, if there's oil on the surface, it will stay on the ground, and that oily puddle will stay there forever. But if there's no oil, it'll evaporate in just a matter of minutes. So sometimes, that's where your dry eye might not actually be your eye itself. It could be because of your eyelid.
An underlying problem. And these, I guess, like getting checked doesn't hurt. It doesn't cost anything, and it doesn't physically, it's not physically uncomfortable.
Absolutely. And optometrists now have access to even more, technology that's out there, including things like meibography, which is an infrared camera, and that's where we take a look at your glands within your eyelid. And if we have some that are starting to kind of start to die or atrophy away, that could lead to a chronic issue for a lifetime. So we want to get to it before this stage. And so some of the new kind of equipment optometrists have let us prevent further problems.
And like, it's your eyes.
Absolutely.
It's your
we only
eyes.
have one set.
No, take care of those things. And just lastly here, you said all these things should be covered by Alberta Health as well. So there really isn't like a barrier to.
That's right. If you're having any medical concerns, we just urge Albertans to go and check in with their family doctor, if there's any systemic concerns, or optometrist if there's any eye-related concerns that they can look into.
Terrific. Dr. Andrea Lasby. And where can we find you here? We can go to, for more information, we can go to optometrist.
Yes, .ab.ca.
Optometrist.ab.ca, or you can follow you on Facebook or on Instagram or Twitter. Where are you guys on?
Oh yeah, so you can follow me at Mission Eye Care. If you're looking up at Instagram or Twitter, that's where we are.
Terrific. Thanks so much.
Okay, thank you.